Welcome everyone to channel medic.24 by 7. So before presenting the topic, I wanted to let everyone know that the information provided in the video is from 2023. Please read the disclaimer before continuing. Even when the things change, most of the information provided will be the same, and I highly recommend everyone to watch the video and research more on the topic. Starting with the topic, I wanted to talk about what made me do this video. When I started pursuing my career in paramedicine, the question I got from many is that how can they become a medic? Well, different countries have their own ways of regulating the paramedic profession in many ways. So, I am gonna talk about the medics in Canada. The other thing which made me do this video is that we need more healthcare professionals right now in our country. Everyone is familiar with a huge waiting period to get a doctor or care, even in the emergency department. It is actually very unfortunate that we have to wait for a long time for care when there is an emergency. Well, the main reason is staff shortage. The same happens with the pre-hospital care providers too. Imagine waiting for a paramedic unit to reach you for like 4 to 6 hours when you have a fractured leg. Well, that would be horrible. What about a cardiac arrest when no ambulance are available? What I'm trying to say is that we need medics, and it's a high time right now with increase in the population. With that said, still you have to ask yourself this question before choosing the path of paramedicine. What made you choose paramedicine? Different people have different answers to the question. I actually asked every single person the same question who contacted me to know about choosing this career path. The answers I got were quite interesting. Some said they wanted to help people. Well, if you're a person who thinks like them, you are at the right place. You will be making changes in people's life, but at the same time, you have to understand that we won't be able to help every single person we meet. Sometimes unfortunate things happen, and that's okay, but make sure you did everything right. Another answer I got was that the medics look cool. Well, you're right. Medics definitely look cool in their uniforms until you respond to a really messy call and then all body fluids are on your uniform. For some, they may choose this path because they grow up watching medics in their family. That's actually great because you might know what exactly the profession is. But still, you have to make sure that this is the right path for you. All you have to think about is the patients we are treating. They should not suffer. Some wanted to become medic because of the pay. Well, police and firefighters get paid more than the medics, right? If you're a person who wants to drive around the lights and siren, this job is not for you. And I'm sorry to disappoint you. And the reputation and respect will depend on what kind of medic you are. You can be a horrible one or a real good one. Like I said before, this job is all about the patient. So, there will be people who still don't know what this profession is. If you ask people around you, they will have very different answers about this profession. So, who exactly is a paramedic and what do they do? Understand this. Paramedics are not ambulance drivers. There are still people who think the paramedic profession is all about driving an ambulance. Yes, it is part of their job to drive an ambulance, but they are not ambulance drivers. Do you call a police officer driving a police car a police driver? We still call them police, right? Even when operating an emergency vehicle is also an important part of this profession, I would say the most important thing will be the treatment. Talking about the treatment, what treatment are they doing? How do they do that outside a hospital? Well, you may have seen them carrying 3 to 4 heavy bags with them when they respond to a call, right? That's not free clothes for the patient. Those are the most pre-hospital treatment tools and probably an EKG monitor for your heart. They treat the patient and stabilize them for the transport, and the patient will be getting more advanced care in the hospital. The medics are the first to see the patient when there is a medical emergency. They sometimes become patient advocates for getting better treatment or to make the life better for the patient. Medic who respond to a psychiatric patient or a family experiencing the loss of family member might become a good counselor for them or a better guide to find out helpful resources for them. The medics are also good history takers and good investigators for a possible disease condition or a potential crime happening in a call they responded to. The medics are an important backbone of healthcare system by potentially saving someone's life who could have died in an emergency. So, with that basic introduction, let's talk about the medics in Canada and what to look for when you choose this profession in this country. There are 3 levels of paramedicine in Canada, depending on the level of care they provide in pre-hospital setting. The level 1 will be the primary care paramedic or PCP, and they are the most we have in Canada. They provide non-invasive treatment and stabilize patient for transport. The second level will be advanced care paramedic or ACP, and they will be performing invasive procedures like intubation, needle decompression, and many more when needed to save a patient's life. The ACPs can be seen working in paramedic trucks and in emergency department. The ACPs and PCPs are the main 2 paramedic level that run the ambulance unit. The third level is the coolest guys who come in helicopters to treat you, and they are called critical care paramedics or CCPs. The responsibility they have is huge. They are called into service when a patient is in critical condition where time and treatment play a role. Choppers travel faster than ambulance, as all of you know, and fly to hospital in no time. The level of treatment a patient gets in the air ambulance is very high. EMTs are medics with basic treatment knowledge and prioritize transport over treatment in most cases. The EMTs are recognized by some provinces and are still working. Some provinces do not have a recognized educational program for the EMTs. NOCP or National Occupation Competency Profile is the one that decides the different practice of scopes for each level of paramedics. The medics who are licensed should be trained according to NOCP, and I will make a detailed video later about NOCP because it won't fit in the whole video to explain everything. So, talking about the education for each level of paramedics, starting with PCP, it is a full-time program and can take up to 1 to 2 years depending on the college. Once you are a PCP, you are considered a BLS or Basic Life Support Care Provider. ACP education takes up to 2 to 4 years, including the previous PCP education time, depending on the college. You need to be a PCP before joining ACP school. ACP is considered as an ALS or Advanced Life Support Care Provider. CCP takes in total of 4 to 6 years, including the PCP and ACP education time. As I said, the time frame still depends on the college you select. You have to be an ACP with experience before joining CCP program. So now you know how long it will take to complete each program and to become a medic. But how do you select a proper college? The first thing you must ensure is that the college you select is always NOCP accredited. If not, you may have to go back to an accredited college before you get hired to do a refresher course or to prove your skills in a simulated lab. There are part-time and full-time courses available. Um, some colleges provide distance education for some level of paramedicine. Note that the PCP program is always full-time because That is the first level, and that's where you learn basics. Time frame for full time, that is 1 year or 2 year, depends on the colleges. Some colleges provide classes from Monday to Friday without any break for 1 year, which includes your clinicals and practicums. This could be intense and stress out many students, but it finishes in 1 year and you can get hired right after that, and you won't forget anything. That's a good thing. There are some colleges which provide education in semester format with breaks of 4 months, which could be more kind of relaxing, and at the same time, you could forget many things if you're not in books for that 4 months. For ACP and PCP, distance or part-time education and full-time may be available in different colleges. I will try to make a video explaining colleges when touching on differences in the provincial regulation. Okay, now let's talk about the government licensing exams. There is College of Paramedics, which you will have to register to work in some provinces. These people are the regulators for paramedics who provide licenses for medics to work in the province. One of the exam most provinces use is the COPER exam, which stands for Canadian Organization of Paramedic Regulators. Alberta, Saskatchewan, Manitoba, Nova Scotia, PEI, Newfoundland and Labrador use this licensing exam. Other provinces will have their own exam requirement and testing system. I will talk about that when I do a video about each province. Northern Territories do not have a regulator and no exams and licenses needed to work in the place. But you will have to get hired by some companies which operate the emergency services there. So again, I will talk about those when I do a video about Northern Territories and medics working there. So that's all about the basic stuff you need to know when choosing this profession in Canada. Now, I would like to talk about something interesting which Nova Scotia government recently did to support paramedic education. The government started a tuition bursary program which provides you with $11,500 of the tuition fee. Well, that's more than half of the tuition. The program was launched in 2023 and could last for next 3 years depending on the funding available. You will have to sign a return of service contract before joining the college, which also means you'll most probably get hired right after your education. Note that this program is only for students taking PCP education. When I was thinking of doing this video, I wanted someone to talk about their experience in this profession, and I got one of my facilitators, who is also a medic, to talk to you all. So let's listen to her now.
So my name's Carrie. I'm an advanced care paramedic here in Nova Scotia. I've been a paramedic for the best part of 10 years now. I started my career as a primary care paramedic in Cape Breton, which is an island off the coast of Nova Scotia. I worked rurally for most of my career, which was awesome. I got a lot of time with patients because we usually have long transport times. Um, and then I got my advanced care paramedicine diploma after about 4 years of working as a primary care paramedic. With my advanced care, it allowed me to do more treatments for patients. So I ended up doing some flight paramedicine as well. I've worked in Manitoba, British Columbia, and up north in sort of the Northwest Territories. And I've also worked Grand Ambulance here in Nova Scotia as an advanced care paramedic. I genuinely think being a paramedic is the best job in the world. It definitely has its days, but you get to see people on the worst day of their lives, which obviously isn't always fun, but the trust that the community has in you to bring you into their lives when they need help the most is a very powerful thing. And you also get to be present when people are born, which is amazing. Like I can't even explain how cool that is. And you just get to help people. You get to be part of your community. You're wearing a uniform. You go out into public. You know, people are sometimes buying you coffees, saying thank you, talking to you. You just feel part of the community in Canada. You get to know your city very well, your towns very well, and you feel like you're really making a difference.
So that's all for now. I will be doing more videos regarding this profession, trying to break and explain more about each part we talked about already here and explaining each province and their medics. So stay tuned. Please support by subscribing to the channel medic.24 by 7 and liking the video. Please also follow the Instagram page for updates. It will encourage me to do more health related informative videos. Thank you everyone for watching me. Stay tuned for next video and see you in the next one. Thank you.